no to all flu vaccines, especially flu vaccines, because that's what we're really talking about now.
Why?
Well, first of all, it's the only infectious disease that we've known in the last 50 years where the vaccine has been available and most people have taken it, and the death rate from flu and pneumonia continue to increase.
But is there a correlation
well,
between
it's hard
the two?
to know there's a correlation, but I think it should be investigated. Everything else, polio, diphtheria, tetanus, the vaccine comes and the death rate goes down. But here's one that's just the opposite. They keep saying, well, the strain is different, it changes, but this is, we have a very serious problem here. No one should feel that I've minimized the flu vaccines, but they don't work. Or flu, it's a serious illness.
Yes.
The CDC says 36,000 people die every year. How come the number doesn't go down? Right now we have almost 75% of people getting flu vaccine. Why isn't the number 34,000?
So you don't have any scientific correlation that you've done or you've seen, but you're saying the numbers just don't seem to add up? Is that what you're saying?
I can't think of another disease that goes along with that. Every other one, the vaccine comes and the incidence gets less.
Okay, if I'm your patient and you say, no, don't take the seasonal flu vaccine, don't take the H1N1, what would you suggest I do as my doctor?
Two things very important. Number one, make sure you have adequate vitamin D levels. You've seen, I'm sure, many of the stories that the majority of Americans are severely deficient in vitamin D. It's partly because for 35 years we've been told you can't go in the sun, and we put sunscreen which blocks the vitamin D. Get a vitamin D test. Everyone should get a vitamin D test. We just tested 100 patients in our practice, and 80 of them, even though I've talked about this for 2 years, 80 of them were low. The magic number, 60.
Why vitamin D?
Well, vitamin D is not a vitamin. It's actually a hormone. It modulates the immune system. And there's been evidence that it has been protective against flu and even swine flu. One of my dear friends from medical school is the medical director in Wisconsin, Madison, Wisconsin, in a children's hospital unit. And they had a bad outbreak of swine flu in the beginning of summer. He has 275 inpatient children. Only 2 out of 275 got the swine flu. 100 workers came down with it. And he's been measuring and watching their vitamin D levels for over 2 years. Not conclusive, but it's evidence. And I'm also an attorney. And evidence means one more nail in the coffin that vitamin D may be a very strong contributory factor to the high incidence of flu.
In the 30 seconds we have, so if the CDC head of it right here was sitting here, who advocated this morning, get both, the seasonal when it comes around and get the H1N1, you would tell him or her,
go ahead and get it if you want, but not for my patients, not for my family. My family is going to make sure their vitamin D levels are high enough. They're going to make sure that they're eating well. They're going to make sure that they don't take aspirin, Tylenol, Aleve, all the things that the CDC is recommending. And the British Medical Journal has here a study showing that those things exacerbate deaths from flu. Japan in 2000 ended the use of routine lowering medication for fever. Their death rate from flu has plummeted since then.
Dr. Mary Eisenstein.
Hi, this is Dr. Meir Eisenstein. My late mentor, Dr. Robert Mendelsohn, said, doctors and drug companies don't let go of a one drug or treatment till they find a more dangerous one to replace it. They've been scaring us about flu. And in 2009, they said that the swine flu would cause thousands of people to die in the street. But it didn't seem to change, and the public is taking less and less vaccines. So now they've got a new one, Ebola. They're going to scare us about Ebola. They're going to make sure we're so scared of Ebola, and then you say, don't have the vaccine yet, but we'll shortly have the vaccine for Ebola. Until now, take the flu vaccine. Doesn't make any sense. Flu vaccine has never worked, but that's what they're going to say. And mark my words, you've heard it here right now.
And we want folks to do the things that they can do to control spread of disease. Another important thing is for people to get their flu shot.
The flu season is coming, and all the organizations, American Academy of Pediatrics, American Academy of Family Practice, Center for Disease Control, the Food and Drug Administration are saying flu vaccine for everyone, and they're including children in this. Yet a study just came out in the American Journal of Clinical Nutrition, vitamin D more effective than vaccines at preventing flu infections. Why would you use anything but vitamin D? Get your vitamin D level tested. Get it above 70 or 80. Most people in this country are still severely vitamin D deficient.
No matter all the hype, the propaganda, the scare tactics, the 36,000 people die every year from flu. And by the way, it's not flu. They say it's flu and pneumonia, because if you eliminate the pneumonia deaths, you have just a handful of people actually die from influenza.